Now tonight's Team 4 special report, a new treatment for varicose veins.
WBC's Dr. Malika Marshall shows us a procedure that not only cures the problem, but gets patients back on their feet in no time.
Beverly, you can come on in. Beverly Mollis hates the way her legs look and feel because of varicose veins.
They're very painful, very unsightly. The bulging basically starts here and it goes right down through there.
Beverly showed us the problem, one she hopes to cure through a brand new procedure.
It's just something that I just didn't want to live with anymore.
Varicose veins are caused by a faulty valve that allows blood to pool in the vessel. The blood eventually forces the vein wall outward, causing it to bulge. The traditional treatment for Beverly's problem is an invasive surgery called vein stripping, which requires general anesthesia and hospitalization.
It has a long recovery time, could be anywhere between 2 to 3 weeks. It's painful. There's unsightly scars left behind. Feel a pinch in here.
Instead of stripping, Dr. Sandra Christensen performs a newly approved procedure called endovenous laser treatment, or EVLT.
And this is the one that has the problem.
Using ultrasound, Dr. Christensen maps out the problem vein. Then a laser probe is inserted into the knee area and up through the vein. The laser heats the vein, causing it to collapse. Blood no longer gathers there, and the varicose vein shrinks back to normal size. The whole procedure takes about an hour.
Hold on, safe, quick. There's no scarring, no complications such as bleeding or infection.
The results were wonderful.
Marilyn Bouchard, who runs a bed and breakfast in Rhode Island, had the procedure last summer.
I have very thin legs, and the veins got so ugly, really, truly ugly.
This is a picture of Marilyn's legs before the procedure, and this one after. Marilyn says there was very little pain during or after the treatment, and she could see a big difference in just 2 weeks.
For the first time in many years, I went to Florida. I put a bathing suit on. I went in the sun and exposed my legs.
EVLT costs between $1,500 and $3,000, depending on the extent of the problem. Some insurance companies pay for it, while others do not. We were able to speak to Beverly right after she was finished.
Went very well. Believe me, the dentist is worse.
And Beverly was able to go back to work that day. Now keep in mind this procedure was just recently approved by the FDA, so there are currently no long-term studies to determine just how successful